The UK is set to investigate racial bias in some medical devices used to monitor COVID-19. It's suspected that some devices, such as the oximeters, may work better in lighter-skinned patients. This means other ethnic groups could be more vulnerable to device errors. Let's discuss this development now with Professor Guy Richards from Wits University's Critical Care Department. Prof, good afternoon, and thank you very much for your time. Were you surprised to hear this? When I saw this story early this week coming out of Britain, I thought, wow, is this really possible?
I was surprised because, in fact, we obviously use oximeters on a regular basis in the hospital. The quality of the oximeters that we use, however, in the hospital are far better than the quality of those that are used at home, those finger oximeters, which are particularly inaccurate anyway. So in the study, when they looked at the presence of low oxygen levels, they found that it was not detected in 6.8% of black patients, and yet only 4.9% of white patients. So there was a missing group that were not detected in both white and in black patients as well. So it is something that...
Sorry, Prof. Yeah. I mean, we could understand the dangers, what this would cause, just to speak about that. But just from your knowledge, since the story broke early this week, is it because there's a device defect, or it was devised in mind only to be used, those devices that you say are not reliable, were devised only to be used on white people, for example, or lighter-skinned human beings?
Possibly. That's a difficult one to actually answer. Do remember that there are all sorts of factors which influence accuracy. Fingernail polish will decrease the accuracy. Thick skin would, for example, in a laborer or bricklayer, might decrease accuracy. The temperature of your finger. There are many other aspects that would also influence or alter the readings. I've never noticed any specific deficit in the hospitals with regard to black patients, and the predominant number of my patients have all been black patients. But the most important thing about an oximeter is that you're looking at a trend. So if you see an oxygen level on the sat meter, then you will correlate that with a blood gas, which is a test that you measure from the artery, where you measure the oxygen in the blood itself. And then, in addition to that, you look to see whether, in fact, that oxygen level is declining. So if it is declining, well, that indicates that you actually have a problem. So the trend is a more accurate reading or more accurate finding than a single readout on an oximeter.
Now, in Britain, they are investigating this. I wonder what the experience is like in South Africa on this, because many people rushed to the shops, to the pharmacies, and last year when this oximeter thing came about, and this was not a known factor. You are saying those that are in use inside hospitals are of a better quality and more reliable. But many households in South Africa today have got the small ones that we put on our fingers. So, like me now, what should I do with mine?
So the most important thing is for you to measure yourself now when you're well. Then you know what on your machine, what is normal for you. If that then is lower than what your normal reading is, then that indicates that there is a problem. So you need to get a measurement when you are still well, so that you know what your reading happens to be.
So currently in South Africa, you are not aware of any implications or impact of this, of these kind of devices that, as I've said, many people went to buy last
I must be honest. I must be honest, because of the fact that we recognize that these machines are not nearly as accurate as measuring the oxygen in the blood itself, that we do look for the possibility that this is not an accurate recording or reading. And we then would look at other clinical features which would indicate that the patient had low oxygen levels. So it would only really be an issue in non-medical people who were looking at these devices and saying, whoa, goodness me, maybe I'm fine, but whereas you might not be, because in black patients, as I say, 6.8% are inaccurate. In white patients, it was 4.8 or 4.9. I can't quite remember, but something like that. But we expect these machines to have inaccuracies.
Okay, but now in Britain, I mean, their research has shown that they work less well on darker skinned people. And some people in the UK now are calling this whole issue of the oximeter as a systemic global issue. What would your advice be as we conclude to say, okay, what should we be aware of in South Africa, where the majority of the people here are black?
Well, as I say, there's only about a 2% difference between whites and blacks in terms of the degree of inaccuracy. But it is important that if you are short of breath and your oximeter still says that you are fine, then you should then seek help and go to a hospital and get a more accurate measurement or more accurate reading at that time. But it's still only a small percentage of people that would have an inaccurate reading. And more importantly, get to know what your normal value is so that you then know if you've declined that something needs to be done.